Welcome again to the Eating Disorder Hope online conference, Anorexia Hope in Healing in 2018. We are delighted to share the next presenter with you. It is Amanda Schlitzer Tierney. She is the Strength and Conditioning Coach at McCallum Place Eating Disorder Centers. Amanda is a NSCA certified strength and conditioning specialist, and she holds her master's degree in sport and exercise psychology from Lock Haven University and her bachelor's degree in psychology from Chestnut Hill College. Amanda is currently the co-chair of the Association for Applied Sports Psychology, the Eating Disorder Specialist Interest Group. Amanda has been working with athletes and non-athletes with eating disorders since 2006. Over the years, Amanda gained a wide range of knowledge for this specialized population and found her true passion, helping individuals incorporate balanced exercise into the recovery environment. And with that, I would like to introduce Amanda Schlitzer Tierney, who will be presenting on elite athletes and anorexia, what coaches, trainers, administrators, and parents need to know.
Thank you so much, Jacqueline. I am so excited to be here today to discuss this important and often misunderstood topic of elite athletes and anorexia. So thank you so much for you and ED Hope for having me here today. So just a little overview. This presentation will cover the mindset and actions of an athlete with anorexia. We'll also talk about how an eating disorder is considered to be a metabolic injury, and we'll also include the pressures that an athlete faces in the sport world. We'll also learn what your role is as a coach, trainer, administrator, and parent in regards to working with an athlete with anorexia. We'll also discuss the elite athlete and treatment, as well as return to sport, and the decision to potentially transition out of sport. So I think it's important to discuss the mindset and actions that an athlete with anorexia often displays. Frequently an athlete with anorexia will struggle with a combination of restrictive dieting, overtraining, maybe skipping rest and recovery days, or missing out on social activities, or work and school obligations to fit their sport training sessions in. They also may struggle with having any flexibility around food and exercise, which often leads them to limit their food intake on rest days, perhaps thoughts that they only deserve food if they've worked out that day, or struggling with patterns of compensation for eating. In many athletic settings, many athletes with anorexia may struggle with comparisons. And this could be comparisons with their teammates or opponents, and they often involve, being really critical of their body weight and body composition, perhaps comparing eating habits, athletic ability, or even comparisons on how they feel like they should stack up with their own, often unrealistic expectations. So you may have an athlete that is a really hard worker, a high achiever, that begins to restrict food and maybe skip meals and skip team gatherings. They might also become more secretive about their workouts. Athletes with anorexia often have this intense fear that if they skip a workout, that they might lose the body composition that they were trying to work toward, and they might lose all of their progress that they've made in previous workouts. And just like most athletes at the elite level, these individuals are really often trying to gain that competitive advantage. So they may put a really high emphasis on striving to get to an ideal weight to improve their sport performance. So they are often afraid that anything that goes against what, feels safe in obtaining that specific body composition or weight will cause them to lose that competitive advantage over their opponents. So this often leads this population of athletes to start adding in those extra training days, extending workouts, and going above and beyond what their coaches or trainers have planned for them. As a result, the athlete with anorexia may truly struggle with not listening to their body cues and really have a tendency to kind of push past or push through illness and injury. So I think this is in part to keep their elite status as an athlete, but it also may contribute to, fear of losing playing time or letting down their coaches, trainers, parents, or even teammates. And I think that this tends to get a little tricky in the sport world, as many athletes may not view restrictive eating or unbalanced exercise habits as a symptom of an eating disorder. Since many of these practices have really become normalized, expected, and even desired in their training environment. So many report, being praised for their strong work ethic and their dedication to sport. So they feel like if they continue to do what they're doing in their disorder, they'll continue to get better at their sport and that they're doing what it takes to be a great athlete. So Thompson and Sherman really did a great job of showing how similar the characteristics look between, the good athlete, quote unquote, and an athlete with anorexia. When I talk with athletes that I work with, there's often a theme that their competitive nature and commitment to their sport is often manipulated by this pursuit to be perfect, rather than achieving athletic excellence, which often leads them down a path of unbalanced eating or fitness training. It's always really inspiring to me through the work that I do with my athletes to be in a position to help them discover that balance between challenging themselves physically to make athletic progress and reach their goals, and then dealing with those unhelpful habits like overdoing it and completely tuning their individual body cues out. So I think it's important to make it clear that athletes with anorexia are not mentally weak. To be quite honest, they're often mentally tougher than most people. So if we can help them tap into their strengths as coaches, trainers, administrators, and parents, and really guide them to working toward their goals in a balanced and sustainable way, they can feel really empowered and be set up on a path to really embrace some of their sport and overall life goals. So now we'll talk about eating disorder as an injury. So if a diagnosis of anorexia is suspected, sport participation should be limited or abstained from until clinically appropriate. This does not mean that having anorexia means the athlete must give up his or her sport. But as coaches, trainers, administrators, and parents, we really need to be proactive, and if the athlete is actively struggling with their eating disorder, we need to make the call to limit or hold sport participation, until nutrition and energy balance are reestablished, medical risk and complications are evaluated, and there's been an eating disorder assessment done, and that there's a plan for follow-up care. And this gives time for the treatment team to assemble. And then the key players like the sport dietitian, sports psychologist, physician, athletic trainer, and coach, as well as a strength and conditioning coach, can have time to collaborate and create guidelines on how to reintegrate fitness training and competition. So I think it's important to note that an athlete with anorexia often have similar difficulties to other injured athletes. So some of these things may be, athletes feel like they don't have an injury because an eating disorder is something that they quote unquote can't see, or nobody can see that. They also may fear, as I mentioned before, losing playing time due to their injury or eating disorder, as well as even more in the temporary or permanent loss of their sport. They may experience distress around the inability to compete and having limited interaction with teammates, which is often a loss because they're around their sport family so often, and they can really play an important role as their support system. So this can be really upsetting if they need to take a step away for their eating disorder. And also, they may have some uncertainty about regaining their prior level of performance. So I think it's really important that we give the support that we would give to any other athlete with an eating disorder and really help them rehabilitate from this metabolic injury. So athletes with anorexia face unique health risks. The signs and symptoms are unique to each individual and they may vary over time. And these athletes may experience impaired concentration and judgment, increased risk of injury and bone health concerns due to patterns of inadequate fueling or overtraining, as well as might struggle with some mental health disturbances like anxiety or depression. They also may feel an overall sense of weakness and fatigue, as well as muscle loss or muscle soreness that often lingers longer than typically expected. Athlete with anorexia may start to notice, more of a slow recovery time post-physical exertion, and they might hit, strength and conditioning plateaus or see a decline in overall sport performance. And this often turns into a loss of passion for their sport. So I think it's really important to note that athletic performance may not initially decline. So with that, we really need to keep in mind that athletes with anorexia may be dangerously medically compromised, even if they don't display some of these signs and symptoms. And also their vital signs and labs may fall within normal ranges and the athlete continues to report feeling fine, and maybe even underplay their struggle, feeling confident that they can manage some of these difficulties on their own. So it's really important just to be aware of what some of these signs and symptoms are. So since the mid-90s, we've heard of the female athlete triad, which includes disordered eating, menstrual irregularities, and bone health concerns. And in 2014, the International Olympic Committee came out with a consensus statement that helps explain the picture beyond the triad. And this is called relative energy deficiency in sport. And I think it's really helpful to see that all of these other factors and body functions are affected by consistent improper fueling and training, as well as a lack of rest and recovery in males and females. I think it's also important to note that female athletes may not view amenorrhea or the loss of their menstrual cycle as abnormal or even a symptom of their eating disorder. And I think that this often goes back to what has been normalized in their sport environment. As many of their teammates may also not have their menstrual cycle or have irregularities. And I think some athletes may view losing their cycle as maybe a marker of success, that they've reached a desired level of training intensity. I apologize for that. So beyond the body image concerns and general life stressors that most individuals with anorexia may struggle with, being involved in the sport world can really include added pressures from coaches, parents, judges, and the media. So as we know, some sports have certain weight requirements for competition, while others may have kind of uncomfortable or revealing uniforms. So these things often intensify maybe already present body image distress. So again, these pressures frequently can lead to increased body dissatisfaction, decreased athletic performance, injury, mood disturbances, and a loss of passion for their sport. All right, so detect, refer, and collaborate. So for everyone involved, early detection and referral is essential for the opportunity for optimal eating disorder recovery. And being able to spot some of these signs and symptoms of a struggling athlete can be beneficial. And it can really minimize medical and emotional risks, as well as reduce disruption to their athletic or academic career. It's also imperative in helping the athlete regain their life overall. So my advice is to get to know your local eating disorder treatment professionals and really start collaborating with them. And I love this graphic. It really shows that there's so many people. It really takes a village to work with the athlete, and the athlete is also a part of the team. So when you suspect an athlete may have anorexia, it's important to only provide services within your scope of practice. So if you're a strength and conditioning coach or trainer like me, it wouldn't be your role to offer nutrition advice or write out meal plans for the child or the athlete. It also wouldn't be your role to act as the child or athlete's therapist, but you would be the point person for the treatment team members to come up with exercise prescriptions and creating that training progression for them. So this is really where collaboration comes in, because I really think that there are so many skilled professionals out there that if everyone works together and stays in their respective lanes, we can really provide the best care to the athlete. So now we'll examine beliefs about health and wellness. So what are your attitudes and beliefs about health and wellness, and how do you communicate them to your athletes and children? I think it's important to think about what messages you are sending to your children and athletes about food and weight, and how you explore how these messages really impact someone who is vulnerable to anorexia. I hear it daily that my athletes with anorexia have often taken really well-meaning messages and they've really fueled their eating disorder. So I think it's important to remember that messages like, the athlete is healthy, he is performing well, are often pretty damaging. And in reality, athletes can be, sometimes perform well despite having a serious eating disorder. But really that's not sustainable, and eventually the disorder begins to affect the athlete both physically and psychologically. I also think some of the messages or beliefs that, thin makes you win, I hear that a lot, or losing weight will help you improve your sport performance, can also be pretty harmful. So weight is just one factor of so many that can impact an athlete's sport performance. So some of the other great examples are, genetics, mental focus, resilience, how you're able to respond to a mistake, your confidence when you're playing sports, being a hard worker, getting enough sleep, being strong, flexible, and balanced, and working on your VO2 max. So I think that those are some other really good examples, and it's not just about the weight. So exploring what factors you as a coach, trainer, or administrator, and even parent are really putting emphasis on in improving sport performance can be really beneficial. And also, we also know that more is not always better with training, but many of our athletes really tend to hold on to that as fact. And so again, I really think it's important to just examine the messages that we're getting out there to our athletes. All right, so what is your role? So I think it's important to get familiar with signs and symptoms of anorexia and related matters, and know that you play a really important role in your child and athlete's life. It's also important to avoid making assumptions like, we never have eating disorders on my team or in this sport, or you know what, I coach boys, that's a girl's issue. I think it's really important to be well informed so that you can help your athlete find care if and when they need it, to support their short and long-term health. So, excuse me, I just needed some water. So when approaching the athlete, I think there's a lot to be said on how that can go. So when approaching the athlete, you may suspect has anorexia or is struggling, it's important to take a non-judgmental approach and tone. And you really want to make the athlete feel safe and supported. And it's best to build or already have rapport with the athlete and approach him or her privately. Definitely avoid making assumptions and be specific and objective with observed behaviors. I think just showing your concern and emphasize their overall well-being is really important. And show the child or athlete that you care about their short and long-term health and that you're here for them if they need someone to talk to. If they're struggling with, unbalanced or exercise habits, that they have someone that they can go to talk to. I think that this conversation can be a really good time to provide them or their parent with the contact information of some of the trusted eating disorder professionals in your area, and or maybe within your sport and academic organization if you have an eating disorder team within your program. And often this conversation can be met with defensiveness and objections, and the child and athlete may minimize or discount your concerns. But just remember, it's not personal, and it's best to follow up after the conversation and continue to just keep showing your support for them. Sometimes athletes are more open to seeing a dietitian as a first step to exploring eating disorder behaviors than they would perhaps a therapist or a psychiatrist. So I think dietitians are often a pretty good person to refer to if you feel they might be struggling with anorexia. So I just have a few ideas of how to start the conversation, especially in a sport setting for the coaches and trainers as well as administrators. So you could say something like, how are you feeling these days? I just wanted to check in. It looks like you have been training pretty hard lately, and I just wanted to see how you're feeling and if you've been adding in workouts beyond your prescribed training. And if they say that they have, just say, I just wanted to see how your body and mind have been responding to this added training, or how's everything else going in your life? I think another thing you could say is, I'm really worried about you because I've noticed that you seem to have significantly less energy than you used to. So just checking in and observing the behavior, or observing that you've seen a shift in their energy. Another one could be, you've been experiencing a lot of injuries lately, which makes me worried that something might be going on with your body. So I think it would be best for us to maybe consult with a physician to make sure that the training that we're adding in is really benefiting you rather than harming you. So these are just some examples. All right, so communicating about weight. So when communicating about weight, you want to involve the sport dietitian, sport psychologist, physician, athletic trainer, and strength and conditioning coach. I think it will often be the dietitian or the physician discussing weight with the athlete. So it's important to know, who your point person is when discussing weight with your athletes in your own athletic environment. And this is important because there's a true sensitivity needed when discussing weight and body composition with athletes who have anorexia. And, some athletes may not want their weight or not want to know their weight, or if they're undergoing treatment, the treatment team may feel it's best to hold off on sharing their weight until clinically indicated. So I think it's really important just to know who on your treatment team or who in your athletic environment is the one person who will be discussing weight with them in an appropriate manner. All right, so getting into individual roles. So coaches and trainers. Maybe I'm a little bit biased since I'm a coach and trainer myself, but you truly have a special place in my heart. You may not realize it, but you truly play a vital role in the life of the athlete. And I have to say, your words and actions have a lasting meaning. So do what you can to really create safe and supportive training environments for your athletes. Encourage proper fueling and training habits, as well as rest and recovery days, as well as having balance, outside of your sport. So having a life outside of competition. Also, if you see another coach or trainer saying something or doing something that can be potentially damaging, I think speak up in a kind and supportive way, of course, because I think that it's really good to have accountability in our field, and sometimes we may not even realize that some of the things that we say or do have that lasting meaning in our athletes' lives. And I have to say, there's not nearly enough resources for coaches. So I'm really happy that we're doing this today, and I appreciate Edie Hope bringing this up and realizing that coaches do need information on how to manage and care athletes with eating disorders. But I really think that the field is definitely expanding, and we have some pretty amazing researchers and clinicians that are including you as the coach and trainer as a part of the treatment team. And it's my personal mission to really make sure that coaches and trainers feel well equipped to detect, refer, and to manage the care of an athlete who might have an eating disorder, or often who have undergone treatment for an eating disorder and they're being transitioned back into their care. So please feel free just to reach out to me if you have any questions. I'm always happy to be a resource, and I'll definitely provide my contact information at the end of the presentation. All right, so administrators. So you make the rules. So I think it's really important to create policies that discourage unhealthy weight loss practices and encourage proper fueling and overall health for the athlete. I think you can create, relationships with eating disorder professionals in your community and really utilize them and collaborate with them to help you create these policies around detection, referral, and management of athletes with eating disorders, as well as, learning how and starting to hold and modify training and competition for athletes. Because I think a lot of times we see athletes have just been able to train and train and train or continue to compete when they're really, really struggling. So as an administrator, I think it's so important to be able to hold that line and create policy around how to hold and modify training. And anything that you can do systematically to communicate consistent messages and expectations to your athlete or staff, I think is really helpful when working with individuals with anorexia. I think consistent messages are so important, so anything you can do there. And also, I think education is key. I think educating athletes and parents about healthy and balanced fitness and eating habits are really important. So you can often do this maybe during preseason at assemblies or like the start of the season team meetings, or even, you know, at any point during the season if you feel like it's needed. So I think education is huge. And sometimes you could even ask one of the eating disorder professionals that are in your community, or even us at the Victory program, to come in and talk about these important issues. So maybe have like a sports psychologist or a strength and conditioning coach that works with eating disorders, or a sport dietitian to come in and collaborate with you during that meeting. All right, parents. So you play such an important support role for your child and athlete. You are likely to see them more than anyone, and you probably notice some of the signs and symptoms before anyone. Signs and symptoms of the eating disorder. So find your support, do your own research on what eating disorder resources are available in your area, and advocate for appropriate care for your son or daughter. I think it's also important to add that, you know, it's important to find support for yourself. You know, many eating disorder professionals will offer resources or support groups for parents. So just make sure you're giving yourself the self-care that's needed too. And you'll also play a key role in supporting your child if treatment is indicated, with holding the line with unified treatment guidelines. So you, again, are part of the treatment team, and you will help hold some of those lines. All right, so do's and don'ts. I think it's important just to go over these, and these are for everyone here. Don't body shame. You know, fitness training shouldn't be a punishment. I think especially for coaches and trainers, I think it's important not to post athletes' weight, body composition, or completed training volumes for the rest of the team to see. So whether it's on a bulletin board or on a shared Google Doc, I think it's really important to just keep that information between coaches. I think don't set weight-related goals. Instead, maybe set some more empowering goals, like, you know, this year I want to perform a pull-up, or I want to improve my VO2 max so I can be faster on the field, or I want to get better at my penalty kicks. So I think getting away from the weight-related goals and getting pretty specific about some of the other goals that can really help them with their sport performance. Don't push diets. Again, food doesn't need to be earned through sport training. And we need to fuel our bodies for training and most importantly for life. So if you're a coach or a trainer or administrator and even parent, I think it's important that you're not pushing diets, but collaborating with a dietitian who can have those conversations with the athlete. Also, don't work out of your scope of practice, as I mentioned earlier, and really collaborate with some of the other treatment team members. And lastly, I think don't expect perfection. So teach your child or athlete to strive for excellence and do their very best, and also help them push out of their comfort zone to accomplish things they didn't think that they could. But I think it's really important that we're not expecting perfection, especially with an anorexic athlete, you know, because they tend to keep themselves to such a high standard anyway. So it's just really important that we're not expecting perfection, and we want to make sure that your child and athlete knows that it's absolutely normal and very human to make mistakes, and help them learn how to navigate those moments where mistakes happen. All right, some do's. So I would say do encourage fueling, hydration, and rest. Do be a role model. So remember to maintain your own healthy and balanced relationship with food and fitness. And do be aware of risks associated with allowing an athlete to continue to train and compete in a state of energy deficiency, as I had mentioned earlier. Again, remember that high performance in sport does not always equal good health, and performance may not initially decline. And I think that this is so important because the athlete might not think that there's anything wrong because, you know, their performance is not declining once they started trying to change their weight or nutritional habits or exercise behaviors. So just remember that it's really important that, you know, good sport performance does not always equal good health. And do create a supportive fitness environment and training environment for your athletes. And with that, I think just minimizing comparing, minimize judging, and really don't even do fat talk. I think it can be really damaging. So helpful and harmful messages that athletes often hear. So some of my athletes have shared some harmful and helpful messages with me, and they were kind enough to allow me to share them when I talk with fitness professionals. So I have a list here that I'll share with you that they've received in some of their sport environments. So some harmful messages may have included, you know, coaches or trainers that have commented on my weight, shape, and appearance, comparing my body to my teammates during practice, before and after weight loss competitions with my team was triggering, touching me without asking was harmful, giving me mixed messages, or telling me that I look thin, or saying, you know, you could be so much faster if you just drop a few pounds. And also praising me for clocking extra hours at the gym have been pretty harmful. Also telling me, you know, you look so fit, keep up the good work. And then after I, you know, keep up the good work and I lose too much weight, you know, what's wrong with you? And lastly, praising my rigid routines or obsessive nature. Some of the helpful comments that they mentioned were the coaches that made me feel safe and supported were the most helpful. Or just ask me if I'm okay in a really friendly and approachable manner. Or tell me, you know, we're concerned about you and we wanted to see how you're doing mentally. You know, can we help at all? Or, you know, it seems like you've hit a plateau. Why don't we set up a session with a dietitian just to see how we can get the most out of your training? I think they also mentioned, and I do this in my groups a lot, you know, announce reminders to the whole team or the whole group. Remember to hydrate or listen to your body or tune into those body cues. I think that's really important. Or it's okay to take rest if you're tired. The trainers and coaches that talked about the importance of rest and recovery days made it more normalized and not something that made me feel lazy. They've also said, I notice, you know, this could be helpful. I notice you don't seem yourself lately. Are you okay? And then this one was great. It was a comment made after having one of those really difficult discussions with her coaches and administrators approaching her about potentially struggling with an eating disorder. So I was in denial. It was hard to hear when someone confronts you with your own struggles. I was defensive and maybe a little mean. It was helpful when I had coaches that were consistent with their messages and continued to hold the boundary that my health means more than my sport and the awkward conversation. So I think that's really powerful. And lastly, I'm not attached to an outcome with your sport performance or your appearance. I just want you to be okay as a whole person. All right, so elite athletes in treatment. So once the referral to an eating disorder professional has been made, the clinician will determine what level of care the athlete needs. So if the athlete continues to work at an outpatient level of care, they possibly will remain active in their career, schooling, and perhaps with their sport team. So it will be the role of the coach, trainer, administrator, and parent to communicate with the athlete and the treatment team so that they can really inform on best practices on how and when to reintegrate training and competition. And it's important that the athlete finds a treatment team if there's a higher level of care needed that really understands eating disorders and has expertise in treating athletes, as well as understands and appreciates the importance of sport in their life. And if a higher level of care is needed, the athlete may need to take some time off from school or work, as well as training and competition. So I think for all athletes, just finding a treatment team that really understands that sport is important in your life and can honor that and also help you through some of the struggles that comes from being an athlete and seeking treatment for an eating disorder. So some treatment targets for athletes with anorexia. In the Victory program, a sport dietitian will work with the athlete to restore energy balance. And as a strength and conditioning coach, I must frequently communicate with the dietitian to determine the caloric needs, to support the energy expenditure in their training. Our sports psychologist will help the athlete expand their self-identity and self-worth outside of their sport and help the athlete utilize a variety of different coping skills throughout treatment. Ultimately, as a team, we just want to help the athlete develop a more wholesome relationship with their food, their body, and their sport. So some treatment challenges for the athlete. So again, going back to challenges and difficulties that come with an injury, I think it's important because sometimes it can be really scary to face some of the eating disorder behaviors head on with a skilled treatment team and taking time off from your sport to deal with the metabolic injury. They also may need to reestablish trust with their team because they might worry about inconsistent messages from all the people trying to provide care for them. Athletes with anorexia are often, also concerned about sport performance decrements that may occur if they enter treatment. So I think it's really important just to note that it can be a really scary time to enter treatment for an athlete with anorexia. So just being really supportive of them. And many of these athletes they're used to logging like serious training hours. So the decreased training volume and intensity can be really startling at first. And I think that they also may be afraid of some of the body weight or body composition changes that occur when modifying their food intake in the treatment setting. And sometimes the patience and time needed for true healing and recovery can be extremely overwhelming. And I think, again, just being really supportive and understanding that they're really scared to maybe confront some of these things. But it's often really encouraging that over time, many athletes with anorexia will really embrace these challenges and start to heal and get their life back. All right, so assessing readiness to reintegrate training and competition. So this is where my role really comes in as a strength and conditioning coach. So when talking about clearing the athlete to participate in fitness, it's not just about the weight. It's really important to look at the whole picture. And an athlete who is medically unstable should not be practicing or competing. So it's important that sport administrators are working with their sport physicians to make sure that the athlete's labs and vital signs are falling within appropriate ranges, and the athlete's bone health and cardiac health are taken into account too. I think everyone in the sport world should really be aware that a low heart rate is often seen as this marker of superb cardiovascular health. But there is a difference between a healthy heart and a bradycardic sick heart. So athletes with a really low heart rate will often come in and believe, that they have a really low heart rate because they've reached their peak condition. And I think this can be true in some cases, but I think it can also be pretty damaging or dangerous. So the athlete must really be motivated to work on a healthier relationship with fitness and be an active participant in redefining what that looks like in sport in their life. Reintegrating fitness training and competition for the athlete is definitely not void of challenges. So it's really important to have a strength and conditioning coach or an athletic trainer or a coach or another fitness professional to really be there and support them through that. And they must really be in a recovery-focused mindset once they start adding their sport back in. The individual must also be accepting of daily caloric increases to support their training plan, show an ability to self-regulate excessive movement or standing, and again, utilizing a variety of different coping skills, especially if exercise or their sport have really been like their #1 way of coping with difficult life stressors. And they also, again, have to be in a mindset where they're not thinking or asking about when can I go back to sport, when can I compete 24/7, because I think that this, increased perseveration about when they can train again can really be fueled by unhealthy motivations around fitness. Okay, so return to sport or to transition out of sport. So as coaches, trainers, and administrators, you can refer to, again, the International Olympic Committee's Relative Energy Deficiency in Sport return to sport model. And it's really helpful, and I think it can help inform your policies and guidelines around an athlete with anorexia returning to sport. Also, the role of the coach or trainer that has experience in exercise prescription and eating disorders is a really important member of the treatment team. And again, I'm not biased here, but I think without fitness training parameters, the athlete will tend to fall back into some of their old training habits, which have most likely been unbalanced and often damaging to their body and sport performance. So the coach, trainer, and or strength and conditioning coach is going to help inform guidelines on frequency, intensity, volume, and progression of their training workouts. Again, with close collaboration with the sport dietitian to be sure that their training is supported by their current meal plan and they're not falling into a state of relative energy deficiency. I also think that it's important to discuss that sometimes an athlete will decide, they might want to transition out of their sport. So this is important because with any life transition, especially big life transitions, it can be pretty difficult. So our treatment team's always there to kind of help them navigate that transition and meet them where they're at and really support their decision whether they decide to go back to sport or transition out. So really helping them navigate what that looks like for them. And I did want to just add, as a strength and conditioning coach, that could look really differently even just for their sport training. So an athlete's training plan and meal plan, if they're going back to sport, could be completely different than if they wanted to transition out and become a recreational athlete. So I think it's just really important to understand what the athlete's goals are and know what's appropriate for them to add in. And then one thing that I often remind our athletes is the notion that not all strength is built in the gym. An athlete with anorexia who's gone through eating disorder treatment often comes out much stronger, both mentally and physically, than they were when they were competing prior to their eating disorder and coming into treatment. And at times, they may have never really tapped into their full potential due to not fueling themselves, for the amount of training that they were doing, or perhaps their focus had shifted to other factors in their eating disorder, like calorie burn, or changing their body composition, or feeling anxious because they're missing a workout, or it's too light of a workout, and not really focusing on improving their sport performance. And I've seen athletes leave treatment with more mental toughness and grit than some athletes without eating disorders. The unfortunate thing is, sometimes we see that when an athlete is actually in a really good place mentally and physically after treatment, some athletic departments or parents just don't want the athlete to return to sport. And this is often due to, the fear that there'll be a liability in their program, or perhaps bad memories of how their eating disorder really played out in their sport setting. So I would absolutely encourage coaches, trainers, administrators, and also parents just to be in close communication with the eating disorder treatment team, when making these decisions, just because, healing and behavior change can truly happen with proper treatment. So it would really be best to have the most up-to-date information on the athlete when making these decisions about their sport eligibility, and not going based off what you have known of them prior to treatment. So I just wanted to end on, returning to sport after eating disorder treatment is absolutely possible. And I think it just really needs to be integrated in a safe and intentional way with the support of the entire treatment team and support system, which includes all of you. So with a high level of communication, collaboration, and support, I think we can all do our part in helping the elite athlete with anorexia reach their full athletic goals, and most importantly, really learn to enjoy their life outside of their eating disorder. So here's my contact information at the Victory Program at McAllen Place, and my outpatient practice, Discovering Balance, fitness coaching and support. Again, I just want to thank Eating Disorder Hope and Jacqueline for having me be a part of this online conference. And as I mentioned before, I'm just so happy to be a resource for anyone that has any additional questions or concerns, or just wants to consult on a case that you might have of an athlete who you might think has anorexia. So feel free to contact me, and I'm happy to answer any questions. So thank you so much for having me today, and I think I'll bring it back to Jacqueline.
Thank you, Amanda. That was fascinating, and I'm so glad that you shared your information, because I imagine a lot of people would like to contact you either at McAllen Place or even in private practice. And I did want to say that McAllen Place is the leader in treating and diagnosing athletes with eating disorders. So definitely you'll want to check out their website. I did put that link in the chat box so people can access it. There's also a PDF of this presentation that you can download that Amanda generously shared. And we have a lot of questions. I'll give you a few, and the rest we will email over to Amanda and ask her to respond within 24 hours.
Sounds good.
The first one was about gymnastics and what your thoughts were about the recent issues with, there was some sex abuse with some Olympic athletes, and they discussed, I guess, weight and diet quite a bit in those interviews. Did you have a take on that?
Yeah, I mean, again, first, it's so incredibly sad to have heard that story, and that they have been struggling for so long. But I think that, as I was talking about earlier, with the added pressures that athletes face, just by, judges and the media and coaches, a lot of that criticism is often around weight. And again, like that inappropriate touching is often, I've had athletes come in and say, like, I've had coaches kind of pinch areas of my body that they said I need to lose to be a better athlete. So I just think across the board, coaches and trainers should really kind of not be putting so much emphasis on weight and really help the athlete perform at their very best in some of those other factors that I had mentioned in the presentation.
Thank you. And the other question is about males struggling with eating disorders, and particularly some of the practices in wrestling. Yeah.
I mean, at the Victory program, we see a lot of males, and I think that it actually happens a lot more than people think. So I think avoiding assumptions that male athletes do not struggle with eating disorders, they absolutely can. And there's been a lot of great research lately highlighting, the struggles that males might experience being an athlete with eating disorder pressures. And there have also been a lot of male athletes that have bravely shared their stories about the pressures that they have struggled with. And I think that wrestling is definitely a sport that people think of often, that athletes might struggle with eating disorder behaviors just due to their weight, sensitivity and being at a certain weight to compete. But I also think that there are so many other sports like football and soccer and basketball and running that male athletes are really struggling with eating disorders competing into.
Good point, that across the athletic compass, that's not just one sport, for sure, for males.
Yeah, definitely.
Well, thank you so much for your time. We have enjoyed it immensely, and I encourage everyone to check out McAllen Place. It's a great program, and we appreciate your expertise in athletes and their care with eating disorders.
Thank you so much. And I wanted to just say we're having an eating disorder and sport conference this summer in Berkeley, California, and it's July 20th and 21st. It's a Friday and Saturday, and I think we invite coaches, trainers, administrators, parents, everyone to come. And we also offer CEUs for coaches and trainers. So just keep that in mind.
Yeah, that's wonderful.
Yeah.
I will have that up on the Eating Disorder Hope site as well, on our events calendar. I'm sure it's published on McAllen Place's website too. So we hope to see you there.
Awesome. Thank you so much, Jacqueline. I really appreciate it.
I enjoyed it, Amanda. Take care. Bye-bye.
You too.